Should you be running during pregnancy? And what about when you should start again postpartum? Hey, I'm Erica Zeal, creator of Nocta Fitness and the Core Rehab program. And this is a big topic of conversation that comes up often. I get asked this all the time. And so I want to talk through some guidelines as to help you to understand when you should start backing off of running and probably stop during pregnancy, and again when we can start picking back up running again postpartum. I know there's always that excitement to lose the baby weight, to get our body back, to be strong again, especially if you are a diehard runner prior to becoming pregnant. It can be easy to just want to get right back into it and to try to maintain your running as long as possible while you're pregnant. And while that might be okay, let's go and dive into some of those. So, when it comes to running during pregnancy, there's a couple things that we need to understand. And again, I feel like there's a lot of yes, do it, no, don't do it, so what do we do? So it is on a little bit more of an individual basis. But I want you to think about something. So when you are pregnant, right, you have the weight of your baby also pushing down on your pelvic floor. So it makes your pelvic floor have to work a little bit harder just by being pregnant, especially as your pregnancy progresses. You have even more weight, the weight of the baby, pressing down on your pelvic floor. And I'm a big fan of strengthening the deep core correctly and appropriately, and a big piece of that is learning to strengthen your deep core. So during pregnancy, we really want to be cautious that we don't overstress our pelvic floor, because we could be adding to potential pelvic floor issues such as incontinence, different prolapsing variations, potentially even full prolapsing, which I talked about a couple weeks ago. I think it's very important that we understand these things. And so running for running's sake of staying in shape and doing it just because you feel like you need to can be okay if it feels okay on your pelvic floor. If you are running, and this goes for pregnant, postpartum, anytime really, postpartum and beyond, if you are running and you are experiencing incontinence or any crazy pressure on the pelvic floor, you're not able to properly correct or connect through your deep core, then that is an indication that we need to take a step back. And it's just for a temporary time. Even if you're pregnant, doesn't mean it's forever. Remember that when it comes to exercising during pregnancy and postpartum. It's not forever, it's a just not right now. Okay? That's one thing I really like to teach, is I want you to teach you the foundational concepts in my Nocta Fitness membership for pregnancy, and then in my Core Rehab program, which is currently open for postpartum and beyond. Because when you really start to learn how to properly strengthen your deep core, it is going to set you up for such better habits for other exercise. It's going to help you to be a better runner. So cut it back to during pregnancy, right? If you feel pressure on your pelvic floor or in your lower abdominal area, and you're not able to properly connect again, or you experience incontinence, then we need to be thinking about other ways to modify. Doesn't mean we shouldn't work out. You absolutely should work out. There's so many benefits to staying active during pregnancy, but let's do things that are going to strengthen our body so that during pregnancy, labor, and then obviously postpartum, our body is best prepared for motherhood. It's hard on your body. Had 3 kids, I know, get it. And the cool thing is that you can get stronger throughout your pregnancy, but we have to be doing the appropriate exercises. So while one woman might be able to continue running farther along in her pregnancy, another may not, and for various reasons. But if you are feeling pressure or incontinence on your pelvic floor when you are running during pregnancy, it's time to take a step back and start modifying that. And you will be thankful you did, because you can now take a step back and really work on strengthening your core appropriately and doing exercises that are going to help you become stronger and not work against you, especially when it comes to the deep core and the pelvic floor. Because this is a real thing, and it is something that is not talked about enough with all of the pelvic floor issues that so many women are experiencing, and so many women feel that there is not a lot to do about it, or they don't know what to do. So I'm telling you right now, there is so much that you can do, and one of those pieces is when it comes to the running and or other little bit more intense exercises. If we feel any pressure on that pelvic floor, we've got to start modifying and backing off on those during pregnancy so that you are strengthening appropriately, so we're not putting extra additional pressure on our back, because if our deep core isn't firing properly, then most likely our lower back does not have the support that it needs. So you might be experiencing low back pain, which is something that can seem to come with pregnancy, but it doesn't have to come with pregnancy. And then when we move into the postpartum phase, there's a lot of women, they've been diehard runners, and if that's you, I really want you to hear me out on this one. Don't think that running is not in your near future. It will be, but I do challenge you to take a step back, really work to strengthen your core appropriately. And for those that are in my core rehab program, know exactly what I'm talking about. That's why they're there. And for those of you that have looked into it or considering it, it's definitely the place to be, because when you take that time to really work at strengthening your core, which can take time to develop for one, and it takes some awareness of your body. So it will come with practice, and know that in the long run, when you've taken a little break, maybe it's only a couple weeks, maybe it's a couple months. It depends. There's so many variables as to how many babies you have, vaginal deliveries, how well are you starting to feel your deep core connect. If there is previous pelvic floor dysfunctional issues, that may take a little bit longer, but know that by continuing to run and experiencing that incontinence, or again, we could put that as CrossFit or any high intensity exercises, or really any exercise that is putting intense pressure or causing incontinence, is not helping you improve your core strength. So I'm always telling this to my moms in the core rehab, especially my runners and my moms who want to do their high intensity exercises, that I tell them, you just have to trust me that by taking a break from those exercises for a period of time, give me a week, give me a couple weeks, and really working on focusing on strengthening and rehabbing your core the correct way, that when you do slowly, and I emphasize that you need to gradually build back up. And again, if you start to notice any signs that maybe you're a mile into your run and now you start to feel that the muscles of your pelvic floor are starting to not connect quite as well, then that's your indication that, okay, a mile run, that's what you've got in today. And you're going to keep working on your core, and you can slowly work to build that up. But if we keep trying to push through it because we want to lose the baby weight, we want to get back into those jeans, whatever it might be, know that that could actually be causing more harm to your body, to your core, and specifically your pelvic floor. And because that is so preventable, even if you are having some incontinence or prolapsing type symptoms, know that we can start work to minimize that. And also, if you don't have any of those issues, don't think it won't affect you. It may not affect you now, but it could be down the road, maybe 20, 30 years. I work with a lot of those clientele, and they think that the incontinence it's just a part of motherhood, and it's really not. It doesn't have to be. So that's a lot of my core rehab program actually came about from the whole diastasis topic, but we've learned, and the moms are really noticing a huge improvement with the pelvic floor benefits of their deep core. So you don't just have to have abdominal separation. It's core rehab for any woman who needs to rehab their core because it's weak, because we've had babies. So don't be hard on yourself, because there's so much that the body goes through, but know that there is things that you can do, and we really need to take and allow our body more time to go through essentially that rehab phase postpartum versus just jumping right back in and going for a run. I've talked to physical therapists and that specialize in women's health in the pelvic floor region, and it would shock you to hear some of those stories about doctors that have told their moms towards the end of their pregnancy, yeah, just keep running as long as it feels okay, but they don't give them guidelines. They don't say, hey, if you're leaking down there, you need to stop running, because that is a sign to your body that is too much pressure for you. And again, if you start up too soon postpartum and your core isn't ready for it, again, it's going to make it that much harder for everything to really heal the way it's supposed to. So by taking a little bit of extra time now, you will be so grateful down the road, because those of you that are in the core rehab program, and for those of you that are considering it, or if you don't know about it, check it out. You will be so grateful, because when you learn the foundational concepts of what I teach, and you start to learn how to modify and what feels best for your body, and then gradually, eventually, we can add a little bit more of that high intensity exercise if that's a goal of yours, and gradually get back into more running, that you will feel so different with that. You will feel your core, you will feel your body in a whole new way. And I say that so confidently, because we have so many women that are feeling that difference, that are seeing such amazing results, and you will then get back to being able to run and do all those exercises and not feel like you are going to pee your pants. When you run a mile or two, you're going to feel stronger in your runs. You're going to run with the right muscles, and you are going to be feeling all the right connections happening through your body. And if you don't know what I mean by connections, well, I explain it all in the core rehab program. So if you are not yet joined, be sure to check it out at ericazeal.com. And if you have any questions, please leave them for me.